Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for joining for our COVID update today. We'll try to keep it relatively brief and hit on both our progress in controlling COVID spread, which thankfully since our last update we have made good progress on, as well as the vaccination progress we're making, albeit today with obviously a significant bump related to the news on the pausing the Johnson & Johnson. So we'll talk about all that, starting with the numbers of COVID infection rates in the county. Right now, total cases just under 14,000. Total tests approaching 337,000. 12,187 have recovered. And unfortunately, since our last update on Thursday, we have had one more fatality in the county, bringing us to 247 Ulster County residents lost to COVID over the last year plus. Hospitalizations are still up higher than they were a few weeks ago, and in particular today we have 15 hospitalized right now in Ulster County hospital beds, and the number in ICU beds is 5, which is a little bit higher than it's been also for quite a while. So we're watching that carefully. We think this is the sort of predictable consequence, unfortunately, of the overall higher infection rates the last few weeks. Now we're seeing those that were very sick drive up our hospital numbers, and I want to thank everybody that's working, all our healthcare workers, to take care of those 15 individuals in the hospital right now, and send our love and our best wishes to those folks and their families as they're fighting COVID right now in the hospital. The good news on the progress we're making, it really is probably most clear on our active case graph. So in the last few days, we are significantly down in the number of active cases, which is very, very good news. We are currently at 1,536 active cases, and as a reminder, at our last update on Thursday, we were at 1,726. So we're down almost 200 active cases in a 3 to 4 day period. That is a credit to everybody following the precautions, and we have to keep that downward trend continuing and get the active case count back in check. So thank you to everybody that's doing that. We're also, I think, starting to really see more and more the effects of our vaccination progress and momentum in bringing those numbers down. So as I've said before, it's really a race at this point. How quickly can we get folks vaccinated before COVID variants can gain any momentum? And so right now we're gaining some ground in that race, thankfully, and we're going to continue to push to do that in the next days and weeks. We're also seeing some positive progress downward in the new positive infection rate. Over the last 96 hours, Ulster County has had a 4.23% new positive infection rate, 4.23%. Those numbers come from testing 4,771 people, 4,771 in the last 96 hours, and having 202 new positives out of that tested. So once again, 4.23%. That's a key number that we need to continue to bring down closer and closer, of course, to zero, but really at least under 1 or 2% puts us in a much more sustainable infection rate until we can get the rest of folks vaccinated. So let's please continue to work on that through the precautions. Hospital capacity, we remain in good shape. We are watching the slight increase in beds. You can see 15 hospital beds overall, 5 ICU beds, but you can also see we have more than sufficient capacity if we do need to surge capability there. Once again, as always, the way that we continue to make headway against the spread, in addition to vaccines, of course, are all the precautions that we've been following for the last year plus: masks, social distancing and avoiding gatherings, and hand washing and hand sanitizer. With the spread of the variants, which at least in some parts of New York City now account for over 70% of the cases between the New York variant and the UK variant, with that, the spread of variants that are more contagious, it's actually even more important. I know that is hard to process mentally, but even more important that we follow the precautions now to check the spread of those variants so that they don't get out of control before we can get the remaining balance of our residents vaccinated. Switching gears to vaccines and where we're at there, we are continuing to make progress in our overall vaccination campaign, thanks to the work of many, as we talked about last week. Obviously, the news last night and this morning from the FDA and CDC as it relates to the Johnson & Johnson vaccine is without a doubt a setback in a few different ways, and I'll talk about that in a moment. But we continue to have very high confidence in Moderna and Pfizer vaccines based on all the data and health expertise. So we're continuing to drive forward there. This week, we've only so far received our direct allocation for Ulster County. I haven't yet gotten the comprehensive countywide allocation, but I can share our Ulster County allocation for the week is 4,170 directly to our Department of Health. That's 3,000 Moderna doses and 1,170 Pfizer doses. So those will come to our health department and be administered at our county pod site at the Hudson Valley Mall, as well as at some walk-in clinics, which we're for the first time going to start holding walk-in clinics. I'll talk more about that in a moment. Again, we're waiting on the other overall allocation numbers, which we'll probably get in the next few hours, and I'll share those in our next update. To give you a comparison, though, last week our county health allocation was 4,200. This week it's 4,170, so essentially receiving the same amount of total vaccine to our health department, and I think we can assume our partners will probably get about this a similar level. So we'll be right around 6,000 to 7,000 doses total for the county, plus the state-run site, which is still running at the fairgrounds. So essentially, we're prepared, even with the Johnson & Johnson pause, to continue to have the same, about the same number of vaccines distributed this week as we have last week and the few weeks prior, which is very good news. You can see that manifesting, and the numbers each week are really picking up momentum in our total vaccination progress. So this week, as of this morning, in Ulster County, we now have over 80,000 residents that have received at least their first dose, 80,266 to be exact, and we're just shy of 50,000 that have now completed both the first and second dose of their vaccine series. That puts us at 44.9% of our total population. And if you sort of factor out those under the age of 16 who are not eligible, we're actually getting pretty close to 60% of that population. So we continue to make progress. I want to thank everybody that's doing this work across our distribution operation, our health department, all of our volunteers and staff at the county pod site, all of our partners, pharmacies, doctors and providers, hospitals, and faith leaders and members of our distribution coalition. We have to continue this work to get the vaccine out. We know, and all the health experts have said clearly, that vaccines are our path to really ensuring not only public health and safety, but frankly, some return to a sense of normalcy. So we're going to continue to drive forward with that. I will say, though, we take very seriously the recommendation from yesterday and this morning from the CDC and FDA. And to be clear and to just hit on that explicitly, CDC and FDA did both, and now along with New York State, recommend a pause on the use of the Johnson & Johnson or Janssen vaccine. We are, of course, honoring that recommendation from the public health experts, as we have throughout all the different aspects of the pandemic response here in Ulster County. Anyone in the county that did have an appointment for Johnson & Johnson, you will not lose your appointment. You don't need to cancel your appointment. We will just backfill that with either Moderna or Pfizer vaccine, which we do have available and continue to anticipate having available. So there should be no interruption to our ability to continue to get those doses out. And our health commissioner put out a statement on this earlier today. She and our team, along with the state health leaders, will watch very carefully this additional review by the CDC and by the FDA as it relates to the Johnson & Johnson vaccine, and make sure that everybody's comfortable before whatever follow-on actions are taken. I do want to, provide a little bit of context, which our health commissioner provided as well, which is that almost 7 million, about 6.8 million doses of Johnson & Johnson have been administered, and so far there are only 6 known cases. That's 6, single digit, 6 known cases of these blood clots in women between the ages of 18 and 46. That is what caused this concern and the call for the pause. I think it was absolutely the right call out of an abundance of caution to take a further look at this. And then based on that further look, all the public health experts will weigh in, and then we'll follow their recommendations on deciding whatever comes next. But I know our health commissioner feels strongly, and I agree, and our medical leaders as well, that overall ensuring vaccination safely, quickly, equitably is still absolutely the critical path for us to get out of the pandemic, and we're going to continue to do our part to do that while always honoring the data and the public health advice. On that note, in terms of things that we're doing to continue to get the remaining about half of our residents vaccinated, we recognize that we're going to have to continue to be flexible and adaptable and shift modes in how we're getting the vaccine out, as many of the people who were sort of actively seeking out the vaccine have received it. We're going to do our part to really make sure that the remaining folks, that we make it as easy as possible for you to get the vaccine safely and quickly, and ensuring equity throughout. Along those lines, I want to thank City of Kingston Mayor Steve Noble and his team. Along with the city, we're holding our first Ulster County walk-in clinic, actually, not tomorrow, on Thursday, excuse me. So Thursday, April 15th, we'll hold in MIDTOWN, Kingston, at the MIDTOWN, at the Andy Murphy Neighborhood Center. We'll hold our first walk-in clinic, meaning you don't need to pre-book an appointment. We know that pre-booking is one of the obstacles that, has made it harder for some folks to come or cause concern. So all you need to do is show up on Thursday, April 15th at the Neighborhood Center on Broadway between 9 and 4 p.m. We'll be administering the Moderna vaccine at that clinic, so that would be what you'll be receiving there. The only requirement is just some form of identity. Does not need to be a driver's license, does not need to be anything official, and once again reiterating, there are no preconditions or immigration status or other documentation status requirements to receive the vaccine. It is available to every resident of the county, and that it is as all of our pod clinics have been, it is a safe place for anyone to come and get this life-saving vaccine. And we'll continue to honor that at all these sites. So again, thanks Mayor Noble for partnering with us on this one. We're excited to do more of these walk-in clinics, and in the coming days and weeks, we'll also be announcing more initiatives to kind of make sure we're bringing vaccine to folks, so that those that have access challenges, it'll be easier and a little bit less stress and challenge for you to get the vaccine. For those that want to get more information about all the vaccine-related things we're doing, or to sign up for appointments, you can go to a single place online. That is VACCINATEUlster.com. VACCINATEUlster.com. This is where we have all of our sign-up links. If you do want to book an appointment, we still have actually hundreds of appointments available this week. So anyone out there over the age of 16 is now, or 16 and older, I should say, is now eligible. You can go to VACCINATEUlster.com, sign up there, and book your exact time, or you can go to the walk-in clinic in Kingston on Thursday. And again, we'll be offering more and more options in the coming days and weeks in that regard. But please spread the word to direct people to that Vaccinate Ulster page. Finally, in the spirit of helping people get their vaccine, we're continuing to offer free rides on any of our UCAT bus routes for folks going to get their vaccine. So please spread the word about this as well. And in particular for seniors and those with disabilities, we can do a door-to-door, curb-to-curb service. You just have to call us the day before and book that, and then we'll come to you, bring you right to the site, and bring you right back. We're really doing everything we can, as I've said before, to just make it as low stress and as easy and free from a cost and economic perspective to get this vaccine. It not only benefits you and your family and your immediate circle, but every person in the county that gets vaccinated is actually doing their part to keep the whole county and the whole region safe as we try to approach that herd immunity number of around 80% of our residents vaccinated. We all have our part to do, not only in wearing masks and following the precautions, but in being vaccinated for the whole community's perspective from a health perspective. Finally, as we wrap up, we still can use for the coming days, weeks, and months volunteers to work as part of our vaccine distribution team at our pod site and our other vaccination efforts. You will receive a stipend for both medical and non-medical volunteers. You can sign up at the site right there, ulstercountyny.gov/volunteer. I want to thank all of our volunteers that have continued to chip in and do that work, whether that's doing one shift or some of our volunteers have done now hundreds of hours, if not thousands of hours of service. Many of them have been at every single one of our vaccine clinics, going back to day one from the Kate Walton Fieldhouse to Ellenville to now at Best Buy and many other places in between. I want to thank them especially. I want to thank all of our frontline workers still putting themselves at risk for the betterment and in service to our community as we get through this pandemic. I want to thank each of you for tuning in and helping spread the word. I want to thank Radio Kingston, as well as Diane and Manuel for their part in keeping you all updated and sharing the information as we get through this challenging time. If you need anything, you can, as always, call our Recovery Service Center. That is 845-443-8888. Or send us an email or go to that webpage there on the screen. Our next update will be Thursday at 3 p.m. By that point, I think we'll have a better sense of our total countywide vaccine allocation. We'll hopefully know a little bit more about the Johnson & Johnson situation, and we'll update you on anything else going on. But in the meantime, please keep up the work to get the COVID infection rates in check. We're finally heading the right direction, downward there, not up or flat, but finally heading down. Let's keep that momentum going. Let's keep the momentum upward on the vaccination rates, and then we will get through this into the spring and the summer and get back to some sense of normal life. I know we're all very anxiously awaiting that. Please stay safe and healthy and look out for each other. Spread the word of this information to each other and stay resilient, and I will see you in about 48 hours. Thanks.